Okay. So as I was saying, the main finding of our survey is that a majority of mothers experience mental health challenges. 67% of the mothers we've surveyed state that they feel overloaded. 67%. This is the mean across the 12 European countries. We have a lot of disparities between countries, but we have countries like Spain or Portugal where around 80% of mothers state that they feel overload. They carry too much on their shoulders. And also, 1 out of 2 mothers, 50%, state that they suffer from mental health problems, from at least one mental health problem. We have asked for specific mental health problems, anxiety, depression, burnout, or peripartum depression. And as you see in the graphs, you'll see the countries that have the highest rates and the lowest rates. Anxiety, Spain and Ireland are the ones with the highest rates. Depression, countries like Sweden or Germany, and burnout and peripartum depression, number 1 is for Belgium. When we ask mothers about what helped them the most, some of them told us, the majority of them, that what helped them the most was to have time for themselves, to have time with their friends and family, some of them medication, but some others stated that they felt alone. As you can see here in these statements, these quotes, one mother said, "Nobody, anxiety and burnout, even doctors don't care. Nobody, I just had to get on with it. No one supported me. I always looked for the strength to get through this." So mothers do feel alone. So why are mothers suffering? From our data, we have identified three factors that are not unique, of course, which I'm going to explain. The first one concerns the workplaces, because when mothers evolve in flexibility and adaptability, workplaces lag behind and stay rigid, let's say. After having a child, 23% of mothers reduced their working hours, and 55% changed their working status. So going from full-time to part-time, from employed to self-employed, to become a stay-at-home mom. And actually 30% among mothers surveyed, are not satisfied with their working status. There are countries like Italy, for example, with 44% of those mothers that are not satisfied with their working status. Now, what is the reason behind changing working status? And the number one reason is to spend more time with their children. They want to take care of them. Then there are other external factors that force them to do so, like financial reasons, not having enough flexibility at work, childcare costs, etc. But keep that in mind. So the first reason was to spend more time with their children. And as you can see in the following graph, we ask mothers how would they preferred to balance work and family life for the different periods of the child lives, because it's not the same to have a 2-year-old and a 16-year-old. And as you can see, until the age of 12, half of mothers stated that they prefer a combination of part-time work and family care. Regarding the moment of going back to work, only 35% of mothers report benefiting from a gradual return to work. Only 46% benefited from adapted working hours, and only 27% have access to teleworking options. Having a child is one of the main things that can happen in a woman's life. And as you can see in this data, they don't feel supported in the workplace. Among the mothers who didn't receive those benefits, we asked them, what would you have liked to have? And as you can see, the first thing is adjusted working hours, then financial assistance for childcare, the ability to work from home, on-site childcare, or gradual return to work. So mothers are asking for some kind of flexibility. And they do have this flexibility, but changing working status or reducing working hours, so they have to find the solution themselves. But as a consequence of this, adapting their careers to the family needs, nearly 27% of mothers state that motherhood negatively impacted their careers. This meaning, for example, career stagnation, because 30% of those mothers felt that their learning opportunities were restricted. Also, this means financial impact. Mothers who saw a decrease in their regular income, almost 40% among those who reported a negative effect of motherhood on work, and also reduced job quality, as part-time jobs are usually of a poorer quality, with less autonomy and less flexibility. The second factor that we have identified is that family dynamics often place a disproportionate load on mothers. Up to 70% of household and caregiving tasks are handled by mothers alone, regardless of their employment status. And this is true even in countries with progressive social policies like Sweden, for example. And this is mainly true concerning the intangible household tasks. We have, among the household and childcare work division, we identified four. So the child's physical needs, the first graph, the child's emotional and educational needs, the household tangible tasks, and the household intangible tasks. And in every country where mothers take on most of the responsibilities alone is a household intangible tasks. This is the mental load, and this reinforces mothers' mental health issues. We also see in our data that mothers are the default parent for children to take care of the children of school age. We find this figure of 35% where mothers take on the responsibility of children after school themselves, and father comes in the third place with 18%. So this adds to the work of mothers. And concerning paternity leave, we've seen that 37% of fathers took no or less paternity leave. And this is a pity because they should be there from the beginning. They would be aware of the importance of caring activities. So it's important for male involvement. And also this perpetuates a role of mothers who take on other responsibilities. And the third factor identified are the public policies that still need to evolve. 29% of mothers, almost 30%, are not satisfied with the duration of maternity leave, and 44% are not satisfied with the allowances received during the same period. We have minimums in the European Union. We have 16 weeks for mothers and just 10 days for fathers. So if we want involvement from fathers, we need longer paternity leaves. This is the rates of dissatisfaction with maternity leaves and allowances by country. For example, in Italy, 60% of mothers are not satisfied with allowances, 57% in Slovakia, 51% in Czechia, and it goes also with the dissatisfaction of the length of maternity leaves. Again, Italy 49%, Portugal 49%, and countries like, for example, Spain 37%. Also, even though the legislations have changed a lot recently. We also see concerning this spending on childcare that 1 in 3 mothers state that they spend more than 20% of their household income on childcare expenses. So again, this remains a private issue that mothers and families have to deal with. And so as a result, mothers are doing a lot at home, mothers are adapting their careers, and yet they get no recognition. As you can see here, 41% of mothers in our survey find that their role is not recognized by society. One may think that motherhood is a lose-lose situation, but having said that, it's important to emphasize that in our survey, we asked mothers to describe motherhood in 3 words, and 80% of emotive words were positive. There were words like love and joy and happiness, but well, it's a lot of mixed feelings, but the emotional ones are always positive. And here you find the detail of the feeling of recognition of mothers' role by society. Swedish mothers do feel recognized, and Italian mothers not so much. And so, as you can see, in order to tackle the problems of motherhood and their mental health problems, we have to tackle a lot of different elements. And I would be delighted to discuss with you about possible solutions. Thank you. And if you have any questions, please don't hesitate.
Thank you very much, Angela. Manjit, would you like to moderate, maybe? Is Manjit still there? We lost Manjit.
No, I'm here. I can help with the moderation.
Yeah.
Yes, we talked with Manjit that we will split. So thank you so much for the presentation. It was very informative, and I was just wondering where we could find the data. Have you published them yet, or is there a report that would be very useful for us to be circulated?
Yes, of course. I will share here the link to our in our website. There is a specific webpage concerning everything regarding the survey, where you will be able to download the global report with the European data, and also you will find one-pagers with the specific information of each country.
Amazing. Great. And just one question out of curiosity. What was the biggest challenge that you have during the survey? I'm sure you had many challenges. Just on top of your mind, what would be like the the biggest challenge that you had?
Well, I would like to say that we felt a little bit frustrated because, questions to ask from others, potentially we have so many, but in order to create a survey that was feasible for mothers that don't have much time, we really had to choose so the questions that we thought were going to give us the more valuable information. But still, there are so many questions that we could have asked, and well, as you can see, the questions are about mothers who are already mothers. So there are no questions about the pregnancy or the birth, who are events that are so important in the life of a woman and of a mother. So yeah, that was a challenge, like imagining what would be the best outcome and decide the questions according to this. And also, today we have all this data that we have analyzed, but we still are in the process of also finding partners to continue working on this data, because there is I don't know if it's called this way, like the plain data, but there are ways to cross the data in a way where we can find other solutions or correlations. So yeah, I would say that those are the 2 main challenges.
Great, thank you so much. So I now must give the floor to the audience because there are many questions here. I can see already, first question was from Leticia. So Leticia, would you like to take the floor and break your question to Angela?
Yes, thank you, Angela. I was really looking forward to have this presentation because it disturbs me deeply that we have so much more protection and support for motherhood and raising children. And at the same time, we seem to go only from bad to worse. But I have a few questions about the presentation. first of all, I see that there are mental health challenges, but could they be, I see there is a sense of being overloaded. There is a sense of being not recognized. There is a sense of, I would like to get more maternity leave. The father should take more paternity leave. We should get a better indemnity for it. But against which measurement are we asking these questions? Or is there a sort of also, how do I put it? The reaction that if they ask you, how do you feel about this? You feel you can finally express your frustration. Whereas if you had, so there comes more out of it than you would expect, but also because we are more listening to it. I wanted to be to know more about the real problems that they have. If you see that they have to take medication, that they have to kind of collapse under the strain, what is the details of that is for me important. The thing that you said was very important about the paternity. Those who do take paternity leave early on, meaning when the baby is born, they understand better what an enormous pressure there is on you to be available for all these smaller and bigger things constantly and constantly, and therefore they remain more supportive. I think that's a thing that we could perhaps hear more about from Angela. I don't know. Thank you.
Thank you for your comment, Leticia. I presented the global data, but of course there is more data, and that you will be able to see in the global report. And as I mentioned, for example, concerning the mental health problems, we did ask the questions about what helped the most. And as I said, mainly what helps the most to mothers is to be able to have time for themselves, to spend time with their couples or with their families. But also there are other resources like medication, like exercise, government support, aid. But what's interesting here is to maybe not only see like the global picture, but also see what works best in each country. Or for example, if you take the data of, for example, single mothers, what works best for single mothers, for example. But yeah, there is a lot. And we also asked questions about how were they feeling? Do you feel supported by healthcare professionals with breastfeeding? Did you feel supported by your partner? We do have this kind of data, but you will be able to see that in the report that you can download in our website. But there is a lot.
What we are doing now is pushing this.
Yes, thank you so much, Angela. And I saw in the chat that we already have the report. So Valerie sent the link, and thank you so much. And then I can see a hand here raised from Eleanor. Eleanor, the floor is yours for Angela.
Thank you so very much, Angela, for that very illuminating report. I think there's some interference. Okay.
Yes.
All
Maybe
right.
Paula, you should mute yourself.
I did mute Paula.
Okay.
Sorry,
Right.
Paula.
I was saying, Angela, very illuminating indeed, especially with the statistics. And of course, with data being the new gold now, it's nice that we have, these statistics to buttress what we have known all this time. For all the bad that COVID is known for, I think, some good or opportunity that came from it was the fact that, spouses or partners stayed at home in a way in which dads and significant others could understand what mothers were going through. My comment really is on the fact that the statistics seem to refer to the space of work or world of work as if it is different to the home. What do I mean by that? For stay-at-home moms, it's a full-time job. For those who, go physically or virtually to a place of work, it's a continuum. So I know those figures might be difficult to get as to, what it means being a mother, in two jobs, two full-time jobs, one in the world of work and in the space of work, and one, restricted within the four walls of the home. There are some cultural nuances that are missing for, people like me in the global South. I can tell you, I've just come back this morning from helping my daughter with my 2-month-old granddaughter, and we have something called omugwo. And that is a very important and crucial part of the grandmother's duties in bringing help to, her daughter and grandchildren. My personal story is that, after waiting for several years to do my residency in medicine, and this was almost 40 years ago now, the letter came in the post saying that I could start this long-awaited residency. And it was a time when I knew my baby would be about 4 weeks old. But I took it because my mom said, I will be there for you. So there I was as an anesthetist, sometimes bending over to intubate, and my breast milk, would be flowing through my theater scrubs, and a kind nurse would throw another scrub over me with the patient on the table. But that's, what you do, as a mother, because you want to do your, carry on with your career as well as, be the breastfeeding mom that you want to be. So those are my thoughts. Thank you, and over.
Thank you, Eleanor. Yeah, well, this is something that we are still studying in the data. But if I recall correctly, I think, but again, this is not to take I think that mothers who are working mothers in our sample have a better mental health than stay-at-home mothers.
Yeah.
I mean, taking on your comment, yes, I mean, I would say I agree on the fact that women who are mothers, still mothers, they should also have the possibility to continue with their careers and with their jobs, because it's important not only on a financial level, but also on to develop as a person. And it's true that in our survey there is a big part of concerning workplaces. I mean, the return to work and so on, because it's very limiting, as you saw. Workplaces are still designed for a person who doesn't have any caring responsibilities, and this has to change. I mean, policies need to change. What happens at home needs to change, but workplaces need to change. So, yeah, that was my comment on your comment.
Thank you.
Maybe if I may jump in, I just wanted also, thank you, Eleanor, so much for your comment. I think you're perfectly right in highlighting the role of a family for supporting mothers. In Africa, we say it takes a village to raise a child. And I think it's really what's missing now. Somehow in Europe, usually people live quite far away from their parents. And so the grandparents have a little chance to be there to help around. The community is not always really existing around people, so mothers do feel very, very lonely, especially during the first few weeks or months, I would say, when they stay home and have to deal with everything by themselves. They are learning the job by themselves, but very insecure and, as I said, yeah, very, very lonely. And I found there was, to address this loneliness, I saw somewhere that in one of the Nordic countries, I think it was Denmark, they are very aware of this fact that new mothers are very lonely, and they set up WhatsApp group among mothers who had babies at around the same time in the hospital, so that mothers can, then network and connect to each other's and support each other's. And I thought it was so simple and such a great idea. I mean, it doesn't cost anything, and it's probably very, very effective. I mean, as a new mother, I would have loved to have just, a few contacts like that to go around in parks, walks around with my baby, with some others, not alone. So solutions could also be very, very simple, but I think the key to all this is really the promotion of a more equitable sharing of all these care-related tasks.
Yeah, and I would like to comment on what you just said, Valerie, and what Eleanor said also, that equal sharing at home is important, but as you were mentioning, like the community is so important, because even if you're two in a family, it's hard to raise children. It's exhausting, actually, and if you don't have external help, you just work and take care of your family. And from what we because we have interviewed some mothers in real life to gather their experiences. And for example, what we have been told is that in Sweden, where you have like very long maternity leaves and so on, but once that ends, families are like very nuclear, and so you enter this dynamic where you go to work, you put your children in kindergarten. After work, you pick him or her up and you go back to your place, and then you take care of your family. But you do all of that alone, and so it is exhausting. And for example, I'm Spanish, and I know, and I live it now that I moved to Spain. In Spain, like the value of the family and the support of grandparents, it's very important, and it's super helpful. And this is something, as you said, Valerie, that we are losing in a lot of European countries. Like sometimes you don't even talk to your neighbor, and it's a society issue in the end. If you have a child, and I don't know, if you have a hard time with your child, you know you I don't know if you will, if you find someone who looks at you in a compassionate way to help with your children, instead of complaining about I don't know, the screams of your child. You know what I mean? Um, but yeah, and so and that we see in the data. So depending on the countries where mothers rely more on family and grandparents than others, and it's and the incidence on the depression rates.
I was actually very surprised by the depression rate in Sweden.
Yeah, we all were. Yeah.
Sally?
Yeah, just from my own experience, the concept of support groups makes a huge difference. When I had my first child, I actually had two sisters-in-law. So I was here in France, far from my family in the U.S., but I had extended family, and so my first child has two French cousins, and one of my sisters-in-law had a child before. And so we at least were able to commiserate together. And then when I was pregnant with my second, it was actually our pediatrician. I made some crack about how mothers need support too. And he told me about an English speaking mothers group. And I think having the cultural input from women who weren't French um, was also really helpful. You know, I'm very lucky with my French family, but it was great to find other older mothers. So I still, you know, all these years later, um, we still support one another. And I don't know if that aspect, it's not state support, it's just a volunteer organization, a community-based organization. But that kind of support is really great for mental health. Just being able to complain and you know, with all the love you may have for your husband, for your family, for your doctors, for everyone, it's just very good to know that other people feel the same way and just be able to express that.
Yeah, and as I said during the presentation, Sally, I mean, I didn't put it as a graph, but like the first, second thing that helped mothers the most with mental health issues was to spend time with themselves and with their family and friends and partner. So that really aligns with you just said. Like we need this social interaction in those moments where you're just with a baby that cries and that needs to just to be fed and to put to sleep, and you need that social interaction with adults. It's so important.
Great. I can see, Leticia, do you have a follow-up question maybe?
Yes, two follow-up questions. Thank you, Olga. It's first of all, it sounds, if you say about 27% of the interviewed mothers said that they felt there was a career setback from having a child, then you must in the first place have a job that has a career aspect to it, which is of course a very small minority of women and even men in the world. Most have a job to earn money, to be outside. That was one thing I was wondering about. And then also about I don't think it's a question for me of equality or equity, not equity, but if this mother who is still breastfeeding and still getting used to separating from her, from that baby in herself, how, if you give her more time, if she can have that time, that would be, but other people would take care of all the practical things. I do not know if you want to equally share with even with the father, if it's other in that measuring, but the support around it so that you can relax while you are building up this new bond with the child that is now, you know, a separate entity from you. I just wondered about that, if there was any in your in the questions or the interviews, the way we're done, if that came out as well. Thank you.
Let me rephrase it to know if I understood correctly. So you were wondering about this 27% of mothers who stated that motherhood negatively affected, but we put it that way, affected their work or career, because as you say, not all of us, I mean, not all people have a career, of course. No, but it's both. It's both. And so we asked about the negative impacts on career progression and also the effects on finances. But I didn't get the second part when you say that to have time.
Yes, the thing is that when you expressed or explained, it was as if the women all asked for more equity in looking after the child. And the way it was phrased and the circumstances described was really a very young baby. And I do think a very young baby, the mother is feeding, she would love to have more relaxed time with that baby if other people took more care of doing the household chores. I do not know if she wants to share that baby out to everybody and then have her equal share in the household chores. That's where I say, let's go for respect for everyone's right, but doesn't mean we all have to have exactly the same share in everything. And that is something that I sometimes feel has been stressed a little bit and comes in, as a sort of due, but I do not see it that way. Thank you.
Yeah, I mean, we don't have questions specifically about what mothers wanted after having their babies to be able to really enjoy the time
Yes.
with their babies, because I mean, because as I said before, we couldn't ask all the questions we wanted to ask because we're limited in the timing and the number of questions and so on. But this is a very good one. And from a personal experience, I completely agree with you. I didn't want anyone to take care of my baby. I wanted me to take care of my baby and someone else to do the rest. But I didn't want I didn't
others
have
to take care of you a little bit.
exactly others to take care of me, exactly. And this is super important, and this is a comment I receive like from friends and so on, that when the baby is born, everyone is focused on the baby, and actually everyone should be focused on the mother, because she is the one who needs support. The baby, as long as he or she has a mother, he will be fine. But we really need to focus on that woman who just did an effort and how do you say that, an amazing thing, giving birth. And as you say, like to be we should let mothers be able to enjoy and bond
Yeah.
with their babies.
Yes.
Indeed.
Yes.
But as far as I know, I've never heard of, maybe that exists, like countries where you receive like household help after having a baby.
You
I,
do in the Netherlands.
ah,
Yes. So you
okay.
really have time, because nobody is, sort of competing with you. She is doing the horrible things, and you're doing the nice things.
But that's super nice indeed. That's super
Yes.
nice.
Yeah,
Yeah.
I had one baby in the Netherlands, and I thought that was absolutely brilliant. I mean, yeah, that was very nice.
Mm-mm-mm.
Caroline, maybe you want to join?
Yeah, hello. Yeah, sorry, my internet is very bad, so maybe this is part of my question has already been answered. I'm not sure. But anyway, I'm a mother of seven, and I remember how it was, and they were all within about 9 or 10 years apart, they all were born within 9 or 10 years. So there were some periods where I was, yeah, I felt like I was like swimming in children, but still I worked actually. I still remember, trying to accomplish something every day outside of my family.
Yeah.
And I remember also that my husband was actually very sort of empathetic and tried to help. And of course, even he wasn't always around, but would arrange that like 2 or 3 times a week, we would go out to the next village. I lived in the Swiss German part of Switzerland, and we would go to the next village just for 30 minutes and have a delicious coffee together. And as others said, I think even sometimes just the slightest offer to help
Yes.
was made such a difference. Even you feel like you have 99.9% of the burden, but then somebody, and sometimes even one of the children, would offer something little, and it would just make a huge difference. So it's amazing, I think, how we discover it. Somehow we're more sensitive. We discover that um, that kind of awareness of efforts of others. And I was just thinking, even the possibility of having some kind of a follow-up survey, something, anyway, some of us here on this call, we are mothers with children who have grown up already. So a survey to the older mothers with questions like, how much do you think this has affected your personal development? And what now is how differently do you look actually at that period, or how do you remember that period when you were really a young mother? And then one maybe very practical question I have is, so what do you plan to do with this survey? Because I find it's very, very interesting, but has it sort of guided World Movement of Mothers to have a certain advocacy focus that you're using with governments, or even is there something we can do as a committee, as the NGO-CSW, that we could help you with that?
I can start maybe with the answer, and then you can you
Yeah,
can complete,
sure.
Valerie. Thank you, Caroline. I really liked your comment, and I would say that mothers, in the end, we can carry a lot, and with very little things, we feel so happy. I mean, that means that we're so efficient machines that with little we can go on and go on. And also that's a very good idea, like a survey to grandmothers, because they already have the experience, the knowledge, the perspective of everything that happened, and it's a very good idea indeed. I mean, here we focused on mothers with children until 17. So children they still have to take care of. But of course, a child is a very long-term project that lasts for your whole life normally. And so what we're doing with this survey and with the data is that we are disseminating it everywhere we can, actually. We're using it for our own advocacy and also sharing it with everyone who advocates for mothers. So we presented the results of the survey in the European Parliament in Brussels at the end of September. And we're trying by every means that this reaches the biggest amount of people, organizations, and so on. And so we're doing everything we can. Actually, we are participating in existing events. We are organizing our own events. For example, in end of January, we'll be in the UK at the London School of Economics, and we'll be talking more about health. We are using social media to reach also influencers who work on parenthood, maternity, so that this not only reaches the legislators or the advocates, but also the general public so that people talk about it, because it's like a hidden topic sometimes. Sometimes it's not like right to talk about the challenges of mothers and so on. So we want this data to arrive to anyone who wants to use it.
Thanks.
Valerie, you can.
Yeah, I have to comment. I think it's important to place the result of this survey in the general context where mental health is becoming an issue everywhere, basically. Yeah, the Special Rapporteur on Poverty actually made a report where he really talked about mental health epidemics. So it's not only motherhood; it's the whole anxiety environment in which we are all living, and also in the world of work. I see that with my own children, they have a lot of pressure for productivity, and it generates a lot of mental health issues as well. So I think we have to be careful about what we say. It's motherhood, or it's also the general environment. Otherwise, to answer Caroline about what we could do at the NGO committee, well, why not? Let's organize a side event to the Human Rights Council, maybe in June, or why not March? I think it could be interesting to bring the result of this survey to the Human Rights Council, for example.
Yeah.
So would be really delighted to work together to do that, and Angela could simply come to Geneva as well.
Anne, I can see your hand raised. Yeah.
is all very, really wonderful, very interesting. And I speak as both a grandmother and a mental health professional. And as a representative at the UN in Geneva for the World Federation for Mental Health, you will be pleased to know that WHO, the World Health Organization, had on its agenda at the World Health Assembly last May an agenda item, a complete agenda item on mental health and social connection. And so this, this is very much being thought about in high-level mental health circles at the moment. And there is a real pressure on communities. And I mean, I feel it for myself in my community or communities where I live, to do something about this. I also think the work environment and the support of colleagues is incredibly important. And I couldn't believe what Eleanor said about when she was working as an anesthetist, that the problem with breast milk, because my daughter-in-law, when my first granddaughter was born, was an anesthetist working in the tertiary hospital, the big training hospital in Oxford. And one day she came home, and we were living as grandparents, and we were all living together. She came home and she said, "I had a terrible time today. I was working with two male colleagues, and I needed to express some milk, and I just didn't know how to get a break away from the theater to do it, or how to tell them even." So perhaps it's better in Africa, Eleanor, than in the UK. But no, this is a really important subject, and maybe we could have a follow-up discussion.
Thank you. Yeah, thank you, Anne, for that. And thank you for making the connection with mental health. And what we see now is that the cases of young children and adolescents using a lot of chatbots, and them being victims also of abuse through those chatbots themselves. 7 kids have committed suicide in the US only the past year. They were instructed by ChatGPT to do so because they had no one to confess their issues. They had no one to speak to because maybe their parents were, busy, or maybe because they didn't have anyone they trusted. So there are so many issues that get much more complicated now with the global community and with technology. So I feel that if things were difficult before, maybe some decades ago, now they're further more complicated and further more dangerous because our kids are exposed to a global community of a lot of high risk activities through this. So I was just wondering whether maybe some questions in your survey are tackling this interaction with technology of young children, and how even parents, because moms, you know, I used to say my iPad was my best nanny sometimes. I was just parking my son there in front of Peppa Pig or something, because I was hands full. I was, working, traveling, trying to do everything. I was a single mom for the first 7 years of his life, so I had like to have some help somehow. So, but I could see the danger. So I was just wondering now, with technology being so much used within the families and by families, I know officially WHO has no data because I was looking up surveys for that, unfortunately. And I was just wondering if you have included any questions or thinking about doing that in the future.
Well, you just gave us the idea. Yeah, I think it's a super important question. Me as a mother, I'm very, very concerned about the use of technology. And yeah, I feel so sad when I see those little kids in front of in front of a screen. But I completely agree also, Olga, that when you're a single mother and you have to do so many things, you find like a nanny in the iPad. But it shouldn't be an iPad. It should be a community. It should be your neighbor. It should be, someone else. And I don't know who told me that, but like new technologies make people that live very far feel closer, and people who are close to us physically, they feel apart because it puts distance between one another. And yeah, a lot of chat GPT and everything, but we really need to connect with the people we have next to us, even in our couples, in our own families, you know. I do think technology is doing a lot of harm in our mental health.
Perfect. So I think we had a very beautiful and very sweet discussion today. I don't see any other. Oh, I see, Leticia, maybe a last comment from you before we close. And on behalf also of Manjit, because she had to jump in urgently to another meeting, but she said she was very grateful, and I'm also very grateful for everything. And Anne, our advisor, we were really expecting for this first workshop to kickstart, powerfully the task force. So thank you so much for sharing the data. Thank you, Valerie. Thank you, Angela. And Leticia will close the meeting today.
No. I don't intend to close it, but I wanted to open it to a new venue again. And that I first of all thank you all for this very important report, also for the suggestion to now, in a cohort type way, the moms who've become grandmothers, how do they look back and how do they do it now? But I even want to go further. There is inside our countries, there is a subgroup of women, of mothers who suffer intensely, and that's the mothers issued from immigration who are in the what they call in France the difficult neighborhoods. I spent the weekend talking with a young woman who is a teacher in one of those environments. You get goosebumps from hearing the difficulties for the mothers to relate to themselves, to relate to the children, to relate to the education, to relate to everything. So I think, how can we do something? How can we get them into a community that's positive and helps them forward? And the second thing is that these issues are also emerging in Africa. And there is a difference between the rural and the urban situation, but still, and I can testify it for myself, you can be very lonely because nobody can understand or explain anything to you. At the same time, if the girl is too young, it's not appreciated, but it's happened and nobody has helped her prevent it from happening to become a mother. So there's a lot, and we find that if you create communities of mothers together, where they can meet, where they can chat, where they can talk, and they can also have a cup of tea, just gently, socializing, it makes a lot of difference, just as much needed in Africa as in many European countries. So I want you to think about that and to say it's not just here, it's everywhere, and maybe we can find solutions that are locally applicable if we are sensitive to the situation on the spot where we are. Thank you.
Thank you, Leticia. That's an actually very beautiful and inspiring take-home message. So, Valerie, you will be sharing the link of the recorded meeting so we can disseminate to the people who could not join today. Thanks once again on behalf of Manjit and Anne and all of the people joining the task force. It was great. Thank you, Angela. Keep up the good work, and we will be in touch for other workshops as well.
Thank you
care.
so much,
Bye.
Olga, for
Bye-bye.
hosting us.
Bye.
Yeah.
Thank you.
Thank you. Take care.
Good. Thank you, Angela.
Bye. Bye.